Your blood is circulating through 60,000 miles of blood vessels right now. And if it is not reaching every destination efficiently, your body is already showing you five specific signs, signs that most seniors see every single day and dismiss as nothing. I have been practicing vascular medicine for 23 years, and the five signs I am about to show you have been present, sometimes for years, in patients who later suffered heart attacks, strokes, and amputations that could have been prevented. In the next 19 minutes, check yourself as I describe each one. Segment 1: Why circulation declines after 65. On camera, calm, educational, 2 minutes. Before the five signs, you need to understand exactly what happens to your circulation after 65, because this biology explains why these signs appear and why they matter so urgently. Change one: arterial stiffening. Your arteries are not rigid pipes. They are living, elastic structures that expand with each heartbeat and recoil between beats, helping to push blood forward through your circulatory system. This elastic function is critical for efficient blood delivery to every tissue in your body. After 65, the elastin fibers within arterial walls degrade and are replaced by stiffer collagen. Your arteries lose their elasticity, becoming progressively more rigid. Stiff arteries cannot expand and recoil efficiently with each heartbeat, requiring your heart to pump harder to maintain adequate blood flow, and they are less able to adapt to changing circulatory demands, producing less efficient blood delivery, particularly to peripheral tissues like your legs, feet, and hands. A study published in the Journal of the American College of Cardiology found that arterial stiffness, measured by pulse wave velocity, increased by an average of 50% between the ages of 40 and 70 in healthy adults without cardiovascular disease. This natural arterial aging is then significantly accelerated by high blood pressure, diabetes, high cholesterol, and smoking, all of which are more prevalent in adults over 65. Change 2: endothelial dysfunction. The endothelium, the single cell layer lining the inside of every blood vessel, is not passive plumbing. It is a metabolically active tissue that produces dozens of compounds regulating blood flow, preventing clotting, managing inflammation, and maintaining vascular flexibility. The most important of these compounds is nitric oxide, which signals surrounding smooth muscle to relax and widen blood vessels in response to demand. After 65, endothelial nitric oxide production declines by approximately 40%, reducing the vessel's ability to dilate when tissues need more blood. The circulatory system becomes less responsive, delivering adequate blood at rest but struggling to meet increased demands. Change 3: microvascular rarefaction. As I discussed in my leg circulation video, aging is associated with the actual loss of tiny blood vessels. Capillaries and small arterioles disappear from tissues, reducing the density of the delivery network that brings oxygen and nutrients directly to cells. University of Texas research found that adults over 70 had on average 25% fewer functional capillaries in their leg muscles than adults in their 40s. This microvascular loss means that even when larger arteries are delivering adequate blood, the final delivery to cells is impaired. Tissues are oxygen deprived not because of large vessel blockage, but because of the loss of microscopic delivery pathways. Understanding these three changes explains why poor circulation after 65 is not simply about blocked arteries. It is about an aging vascular system that is simultaneously stiffer, less responsive, and less densely networked than it was at its peak. And the five signs I am about to describe are the visible and feelable consequences of these changes. Sign 1: cold hands and feet that never warm up. Touch your hands right now. Touch your feet if you can reach them. Are they noticeably cold? Colder than the rest of your body? Colder than the room temperature suggests they should be? Even when you are warm? Even when you are wearing socks? Even when you have been sitting comfortably for an extended period? Persistently cold extremities, hands and feet that feel cold regardless of ambient temperature and that do not warm up despite normal warming measures are one of the most consistent and most overlooked signs of impaired peripheral circulation in adults over 65. The mechanism is specific and direct. Your body maintains core temperature as its primary thermal priority, keeping your vital organs at the precise temperature needed for optimal function. When peripheral circulation is impaired, when blood is not flowing efficiently to your hands and feet, your body sacrifices peripheral warmth to protect core temperature. Less warm blood reaches the extremities, they cool, and because the impaired circulation cannot respond adequately to warming signals, they stay cold. The distinction I want you to understand is between the normal cold hands you might experience in a genuinely cold environment, which warm up promptly when you go indoors or put on gloves, and the pathological cold of impaired circulation, where your hands and feet remain cold in warm environments, take unusually long to warm up when you try, and feel cold to others who touch them even when you yourself are comfortable. Raynaud's phenomenon, a condition more common in women and more prevalent after 65D, produces an exaggerated version of this response. Exposure to cold or even emotional stress triggers dramatic blood vessel constriction in the fingers, producing a characteristic sequence of color changes, white as vessels constrict and blood is expelled. Blue as the oxygen depleted blood that remains is visible through the skin, then red as vessels dilate and blood rushes back. If you experience this color sequence in your fingers, mention it specifically to your physician as it requires specific evaluation and management. Persistent cold extremities, particularly in the feet, also raise the specific concern of peripheral arterial disease, significant narrowing of the arteries supplying the legs. PAD affects approximately 12 to 20% of adults over 65 and is one of the most under-recognized cardiovascular conditions in older adults, despite being one of the most dangerous. Cold feet combined with any leg pain during walking that resolves with rest, a pattern called claudication, is a classic presentation of PAD requiring urgent vascular assessment. Ask your physician to include an ankle brachial index measurement at your next appointment. This simple, painless test, comparing blood pressure at the ankle with pressure at the arm, can diagnose or rule out significant peripheral arterial disease in minutes. Sign 2, swollen ankles and legs, especially by evening. Look at your ankles and lower legs right now and think about how they look by the end of the day. After you have been on your feet, after you have been sitting for extended periods, do they swell? Do your socks leave visible indentations when you remove them in the evening? Does the skin around your ankles feel tight or look puffy by late afternoon? Evening ankle and leg swelling, called dependent edema, is one of the most common complaints in adults over 65. And while it has multiple causes, some serious, some less so, when it is persistent, progressive, or bilateral, present in both legs simultaneously, it is almost always a sign of circulatory dysfunction that deserves formal evaluation. The mechanism in poor circulation is this: when venous return force, the flow of blood back from your legs toward your heart, is impaired, blood pools in the leg veins. The increased pressure in these congested veins forces fluid out of the blood vessels into the surrounding tissue, producing the visible swelling we call edema. Venous insufficiency, a condition where the one-way valves inside your leg veins fail to prevent blood from flowing backward, is the most common cause of dependent leg swelling in adults over 65. These valves normally allow blood to flow upward toward the heart while preventing backflow. When they weaken or fail, blood pools in the lower legs, veins become engorged and visible, and fluid leaks into surrounding tissue. But the same swelling pattern can indicate heart failure, where reduced cardiac output allows blood to back up in the venous system, or kidney disease, where inadequate fluid removal produces tissue fluid accumulation, CHU, or deep vein thrombosis, a blood clot in the deep veins of the leg that is a medical emergency. The self test I described in the feet warning signs video applies here. Press your finger firmly just above the ankle bone for 5 seconds. Release. If the indentation remains, pitting edema is present. Pitting edema in both legs that has been progressively worsening warrants physician evaluation this week. Additional warning signs that elevate the urgency significantly: swelling in only one leg rather than both, particularly if accompanied by warmth, redness, or pain in the swollen leg, raises immediate concern for deep vein thrombosis. A DVT can release a clot to the lungs, a pulmonary embolism, which is life-threatening. One-sided leg swelling with any of these additional features is a same-day emergency evaluation. Sign 3, varicose veins and visible leg veins. Look at your legs, particularly the backs of your calves and the inner aspects of your thighs. Do you see veins that are visibly enlarged, rope like and dark blue or purple, raised above the surface of the skin and traceable along their course? These are varicose veins, and while they are commonly considered a cosmetic issue, particularly by seniors who have had them for years and whose physicians have never raised concerns about them, varicose veins are in fact a sign of venous insufficiency, the same valve failure I described in the swelling section that deserves medical attention beyond their appearance. Varicose veins develop when the one way valves in the superficial veins of the legs fail. Blood that should flow upward toward the heart instead flows backward, pooling in the veins below the failed valve. The veins become engorged with pooled blood, dilating and distorting into the visible rope like structures we call varicosities. The circulatory significance extends beyond the veins themselves. The chronic venous hypertension, elevated pressure in the congested leg veins, has consequences for the surrounding tissue over time. Skin changes, brownish discoloration of the lower leg skin from iron deposits left by red blood cells that have leaked from the congested veins, called lipodermatosclerosis, indicate long-standing venous hypertension and significantly elevated risk of venous leg ulcers. Venous leg ulcers, open wounds on the lower leg, typically above the ankle, are the most serious complication of untreated venous insufficiency. They affect approximately 1% of adults over 65 at any given time, and they are notoriously difficult to heal because the chronic venous hypertension that created them continues to impair wound healing as long as the underlying venous insufficiency is untreated. A study from the University of Edinburgh found that untreated moderate to severe varicose veins progress to skin changes in approximately 30% of cases over 10 years, and to venous ulceration in approximately 5% with the risk significantly higher in adults with diabetes or obesity. If you have varicose veins that have been present for years without formal evaluation, request a venous duplex ultrasound from your physician. This non invasive test maps the venous system of your legs, identifying which valves have failed, which veins are affected, and what treatment options are appropriate. Modern minimally invasive treatments for varicose veins are highly effective, and treating them prevents the skin changes and ulceration that represent their most serious complications. Sign 4: leg pain, cramping, or heaviness during walking. Think carefully about this question. When you walk, particularly when you walk uphill, walk quickly, or walk for more than a few minutes, do you experience cramping, aching, heaviness, or fatigue in your calves, thighs, or buttocks that forces you to stop or slow down? And does this discomfort resolve within a few minutes of rest? If yes, you may be experiencing claudication. And claudication is one of the most specific and most serious signs of peripheral arterial disease in adults over 65. Claudication, from the Latin claudicatio, meaning limping, is exercise induced leg pain caused by inadequate blood flow to working leg muscles. Here is the mechanism. At rest, your leg muscles require modest blood flow that even significantly narrowed arteries can usually provide. When you begin walking, your muscles' oxygen demand increases dramatically. Narrowed arteries cannot increase blood flow sufficiently to meet this demand. The muscles become ischemic, starved of oxygen, producing the characteristic cramping or aching that forces you to stop. When you rest, your muscles' oxygen demand falls back to the resting level that the narrowed arteries can supply. The ischemia resolves, the pain disappears, and you can walk again until the demand again exceeds supply. This reproducible pattern, pain with a predictable walking distance, relief with a predictable rest period, is what distinguishes claudication from other causes of leg pain and makes it clinically diagnostic of peripheral arterial disease. The significance of claudication extends far beyond the leg symptoms themselves, because the arterial narrowing that restricts blood flow to your legs during walking is the same disease process, atherosclerosis, and that is narrowing your coronary arteries and your carotid arteries simultaneously. Adults with peripheral arterial disease have a risk of heart attack and stroke that is 2 to 4 times higher than age matched adults without PAD, even when they have no cardiac symptoms at all. The leg symptoms are the most visible manifestation of a systemic arterial disease that is simultaneously threatening your heart and brain. A study from the American Heart Association found that fewer than 25% of adults with symptomatic PAD, adults who have claudication E, had been formally diagnosed. The vast majority attributed their leg symptoms to arthritis, muscle weakness, or normal aging and never mentioned them to their physician. If you experience reproducible leg cramping or heaviness during walking that resolves with rest, mention this to your physician at your next appointment and request an ankle brachial index test. Do not wait. The cardiovascular risk associated with undiagnosed PAD is too significant to defer. Sign 5, skin changes on lower legs, color, texture, and hair loss. Look at the skin on your lower legs from the knee to the ankle right now. Is the skin a normal, healthy color with normal texture and normal hair distribution? Or do you notice any of the following changes that are specific signs of chronic poor circulation? Brownish or reddish brown discoloration, particularly on the inner lower leg above the ankle, indicates hemosiderin deposition. Red blood cells that have leaked from congested veins into surrounding tissue break down E, releasing iron containing hemosiderin that stains the skin permanently brown. This skin staining is a visible record of chronic venous hypertension, indicating that your veins have been congested and leaking for an extended period. Skin that appears shiny, thin, and tight with a stretched appearance over the lower leg indicates lipodermatosclerosis, an inflammatory hardening of the skin and subcutaneous tissue driven by chronic venous insufficiency. This skin change significantly impairs wound healing, making any injury to the lower leg extremely difficult to heal. Absence of hair on the lower legs and feet, particularly in men who previously had leg hair, is a specific sign of arterial circulation impairment. Hair follicles in the legs and feet are among the most metabolically demanding skin structures, requiring constant blood flow to survive. When arterial circulation is significantly reduced below the threshold needed to support hair follicle metabolism, the follicles atrophy and hair growth stops. Hair loss, restricted specifically to the lower legs and feet in the absence of any skin condition or medication that would explain, it is a clinical sign of peripheral arterial disease. Pale or mottled skin, a patchy pale or lace like purple pattern across the lower legs, indicates severely reduced arterial blood flow to the skin. This pattern, called livedo reticularis when the network pattern is present, reflects the compensatory dilation of superficial vessels attempting to extract maximum oxygen from inadequate arterial flow. Dry, cracked skin around the heels, while often attributed to simple dryness, can also indicate reduced sebaceous gland function from poor circulation. The sebaceous glands in your skin require adequate blood flow to produce their moisturizing secretions. When circulation is impaired, these glands produce less sebum, resulting in dry, cracked skin that heals poorly and creates portals of entry for infection. A study published in the British Journal of Dermatology found that lower leg skin changes, including hemosiderin staining, lipodermatosclerosis, and reduced leg hair, were present in over 70% of adults with clinically significant venous insufficiency, and that these skin changes preceded venous ulceration by an average of 4.2 years, providing a window of opportunity for intervention that most seniors and most physicians missed. Now, the most important part, what to actively do about poor circulation, because circulation is not a fixed state. It responds to intervention, and several evidence based strategies can meaningfully improve peripheral blood flow in adults over 65. Strategy 1, daily walking. Walking is the most evidence supported intervention for peripheral arterial disease and venous insufficiency simultaneously. For PAD, supervised walking exercise programs have been shown to increase pain free walking distance by over 100% in adults with claudication, more effectively than medication alone. The mechanism involves stimulating the development of collateral blood vessels, alternative pathways that bypass narrowed sections of artery. For venous insufficiency, walking activates your calf muscles, which act as the primary pump returning blood from your lower legs to your heart. Every step contracts your calf muscles, compressing the leg veins and pushing blood upward. Regular walking maintains this pump mechanism and significantly reduces venous pooling. Even 20 to 30 minutes of daily walking, at whatever pace is comfortable, produces meaningful circulatory benefit. If claudication limits your distance, walk to the point of discomfort, rest, and then continue. This interval approach to walking with PAD has been shown to produce equivalent or greater improvement than continuous walking. Strategy 2, compression stockings. For venous insufficiency specifically, Graduated compression stockings provide external pressure that supports failing vein walls, reduces venous pooling, decreases swelling, and significantly reduces the risk of skin changes and ulceration. Medical grade compression stockings, typically 20 to 30 millimeters of mercury compression, are available on prescription and through medical supply stores. They should be put on in the morning before getting out of bed, when leg swelling is at its minimum, and worn throughout the day. A Cochrane systematic review found that compression stockings significantly reduced leg swelling, improved venous blood flow velocity, and reduced the progression of venous skin changes in adults with chronic venous insufficiency. Strategy 3: Dietary nitrates. Foods rich in dietary nitrates, beetroot, arugula, celery, and spinach in moderate amounts, provide your body with nitric oxide precursors through a pathway independent of endothelial function. Even in seniors whose endothelium produces less nitric oxide, dietary nitrates can produce meaningful vasodilation and improve peripheral blood flow. A study from the University of Exeter found that beetroot juice consumption significantly improved peripheral blood flow and exercise tolerance in adults over 65 with peripheral arterial disease through dietary nitrate conversion to nitric oxide. 5 steps starting today. Action step 1. Today, perform the complete circulation self check. Touch your feet. Are they cold? Press above your ankles. Is there pitting? Look at your lower leg skin. Any brownish staining, missing hair, or shiny, tight skin? Think about your walking. Any reproducible cramping? Any visible varicose veins? Action step 2. If you identify 2 or more of the 5 signs, call your physician this week. Request an ankle brachial index test for peripheral arterial disease. Request venous duplex ultrasound if you have visible varicose veins, leg swelling, or skin changes. These are non invasive, painless tests that directly assess your circulatory status. Action step 3: Begin daily walking today, even 10 minutes, every day without exception. Walk to the point of any discomfort, rest, continue. Progress gradually. Your circulation will respond. Action step 4: Add 1 dietary nitrate food to your daily diet starting tomorrow. A glass of beetroot juice, a handful of arugula on your salad, a stick of celery with lunch. Simple, inexpensive, directly vasodilatory. Action step 5: Share this video with every senior in your life who has cold feet, swollen ankles, or leg cramps when walking, because they are almost certainly attributing these signs to normal aging when they are their vascular system asking urgently for attention. Your circulation is the river of life running through 60,000 miles of your vascular system, delivering oxygen, removing waste, healing wounds, feeding every cell of every organ that makes you who you are. When that river slows, when its banks narrow and its flow becomes sluggish, your body speaks through cold hands and feet that never warm, through ankles that swell by evening, through veins that have given up their shape, through legs that cramp when they are trying to carry you forward, through skin that has changed color and lost its hair. These are not the sounds of normal aging. They are the sounds of a circulatory system that needs attention, intervention, and the specific strategies that science tells us can meaningfully improve blood flow even after decades of gradual decline. You now have the knowledge to recognize these signs, and you now have the strategies to respond to them. Walk daily, eat your nitrates, see your physician, wear your compression stockings, and listen to what your circulation has been quietly trying to tell you. Subscribe to this channel for more senior specific, evidence based health information every week. Hit the like button if this changed how you think about your legs and feet. Leave a comment. Which of these 5 signs do you recognize in yourself? Thank you for watching. Keep your blood moving. Everything depends on it.